Hi there, welcome back. This is Casey, and I am doing a video today. We are continuing on our topic of the heart, so this will be part 2. And today I'm going to be showing you guys some more specific signs that you may be seeing regarding the health of the heart. So we're going to be looking at different organs and glands that are directly connected to the health of the heart. And I have a few more irises to go over with you, and just going to clear this. There we go. So, and I want to show you a couple things on the chart before we get started. So also, I would like to thank you guys for your comments and your likes and your questions. And yes, I am offering readings right now currently, and you can check out the description box for that information. And I'm also, you guys, posting on Instagram. So I'm doing video shorts or iridology shorts, and also pictures of irises as well as portal plants. So if you are on there, check it out if you would like to. That will be posted also in the description box. So let's go ahead and look at the heart again, once again, and its relationship. So we have, again, if you haven't seen the first video, that was part 1. So we just looked at the basic location, but I did go over that in more detail. So I am going to jump right in, and I think I will just quickly highlight the heart. And then in the picture version. So I want to show you a couple things on the chart before we move on to some eyes. One thing that we're going to be noticing today, and at least I have 2 or 3 eyes that I want to go over. And I know in at least 2 of them, when I first looked at them, I did see signs in the heart and the thyroid. So I do want to talk about, so we have the thyroid at about 9:30 o'clock. And then the parathyroid is more center in towards the pupil. And we can find the parathyroid in this area. So that's coming up, and we're going to see that, and I will explain from my perspective why the thyroid is so intricately connected to the health of the heart and the blood and the circulation. And then another thing that's coming up that's fairly obvious is going to be the kidney, and as well the adrenal glands. So I'm seeing that in a couple of the irises, and I'm also seeing these are things you're going to be looking for that sort of just back up what you see, and will also help you to understand how to help yourself or help your client in which way to approach healing the heart, whether it's something that's coming from a weakness within the heart itself. Usually that would be related to the parathyroid in terms of structural weaknesses, prolapses. And then also a lot of what we're going to be seeing is actually more related to the health of the cardiovascular system, and in particular, the blood itself. So we're going to be looking at the condition as best we can see it in the iris of the blood, and that's going to involve the skin. So we're going to be looking at this outside zone, I believe it's zone 7, the skin zone. And again, I am seeing in a couple of these irises some darkened skin zones. And what you'll notice too is that the skin zone will, if it's a weak skin zone, it will relate to the organs and the anatomy that is inside of that area of the iris. So we'll be seeing that skin zone actually in the area of the heart. And then another thing to look for, so I think of the whole entire, 2 to 4 area approximately as the heart and lungs and chest, breast area. And then just below, so that would be 2 o'clock. And then we have the 4 o'clock would be the arm and hand. So that's that. And then just outside, just below the 4 o'clock is the spleen. So we know that the spleen has a special relationship with the blood. And that will be coming up. And just because also it's so close to this zone, there may be signs that you'll see that might relate and connect the spleen to that area, such as a transversal. So, yeah, I think also we'll check the medulla and we'll just see what else comes up, okay? So, I did this eye here, if you watched the first video, and I realized after, I could have probably gone on and on about this eye, but there are definitely some more signs in this iris that are related to what I was just talking about. So I think just real quick, I will show you. This is such a great eye for showing what can happen in the heart and the health of the heart as seen in the iris. But let me see, where do I want to start with this? You can see straight away that we have the 6 o'clock zone is the thyny foot. And then we have the adrenal gland pretty major sign of weakness. We have right on that adrenal gland, and then a pretty well defined also weak area, very, very well defined in terms of the kidney. So even though this whole area technically outside of 6 o'clock is going to be the kidney zone, you can see this radii solaris actually, and you can actually see how it comes from the stomach and the bowels, how it is sort of defining in some ways. It's sort of, for me, that's how I see it. It defines that area of the kidney. So you can see that coming from here and then going all the way down, and then a nice, pretty chronic lacuna right in the adrenal gland area. Okay, so also in this eye, we have something of, I'm going to have to erase this to show you. Okay, so let's just clear out this whole area. Because, yeah. So even as we see that this would be 4 o'clock approximately, it's awfully, awfully close to that spleen. I would say that you could connect this radii solaris to this radii solaris here, and that the spleen would be in this general vicinity. So nothing major in the spleen area outside of a pretty dark lacuna that is covered up. So right in there. Nothing major in terms of the spleen, but it does definitely catch your attention a bit. So as well, so Dr. Jensen talks about one of the ways you can see a weakness in the heart in terms of nerve strength, and that would be connected to the connection between the heart and the medulla, and just in general, the strength of the entire nervous system, especially the autonomic nervous system, would be a diamond-shaped separation in the bowel wall. And you can see that there is a small instance of that occurring just above that lacuna in the heart area. So we have the bowel wall. I'm going to redraw it here. So you can see that, and then you can see right here that there's a separation in that bowel wall in the fibers. Right about in here. And so Jensen describes it as a stream that splits and then comes back together. And that was one of his most definitive ways of seeing a weakness in the heart area. This is interesting because you know the aorta is superior to the actual, body of the heart itself. And this feature here would be really in the aorta area, even more so than the heart itself. So we have a pretty significant sign in the aorta. And then we also have another thing that Jensen talked about was weakness seen in the nervous system through the occurrence of radii solaris cutting through that anywhere in the heart zone, but we do have radii solaris cutting through what would be pretty dang close to the aorta. I would say that would be exactly where the aorta would be representing itself. So we have that, and then we have our lacuna that we talked about in the first video. And then we have a few more, again, back to showing the radii solaris going through, cutting through the autonomic nerve wreath in that area. Okay, so in this eye, we are seeing, I'm not going to really comment on the skin in this eye. I will, let's take a look and see, because I feel like although the thyroid itself is not really showing too much signs of stress, there is some pretty significant markings. So thyroid would be somewhere around 930. So if we have 9, you can see that there's a lot going on the inside of the autonomic nerve wreath or the bowel wall right in that thyroid area. So if this were my client, I would ask them to, maybe, first of all, if they've had any blood work for their thyroid. The thyroid can affect, low thyroid is a really common occurrence when you're looking at cardiac insufficiency. If you have a low thyroid, your blood is moving slow. It controls your metabolism, so everything is very sluggish, and slow blood is going to stress the heart out. It's not getting enough of a blood flow. So that's how the thyroid, in brief, will affect the heart. And if you have someone that has heart dysfunction, definitely check their thyroid, because that's something that you could help them out with in terms of considering thyroid glandular. So the thyroid here, you can see inside the bowel wall, there's a lot going on. And I would say that this would be something more I would also be concerned about the parathyroid, because the parathyroid is so close to that bowel wall. It'd be like more in here. And then the thyroid would be that whole entire zone outside of that, right around the 930. So this is, you know, I am seeing a lot of features in this iris, but this is a strong constitution. It's not like this person is, you know, headed for some major problems or anything like that. And I'm saying that because it's really not much that you see in the thyroid, but because of that really strong signs of possible inherent weakness in the heart area, definitely I would be checking the thyroid, because that again would be something you could help this person if they are having heart problems. Okay, what else? You know, there's a lot going on up in the brain area, definitely pituitary and pineal, which is, you know, the mother of all of the pituitary being the mother of all of the glands. So that could definitely be something you would notice, especially with the potential weakness in the thyroid and the probable weakness in the adrenals. Okay, so I think that's all I wanted to cover. In this eye. If I think of anything else, we'll come back to it. So far, we are looking at the connection to the thyroid, the kidneys. The kidneys' role in the health of the heart is enormous, and even though you know, current medical establishment does recognize it, I feel like it goes underspoken about and recognized quite often. If you have heart problems, it's usually coming from your kidneys, because the kidneys filter the blood. And if the kidneys are not filtering the blood, you have a lot of toxic blood going through your system and going through the heart. And the blood can become any range of thickness, and you know, it can't necessarily go out of that level of the pH that it stays at, but it sure does, how do I say this? It's sure able to reach a high level of toxicity and thickness without getting into that dangerous pH where you wouldn't, you know, have your heart beating. So definitely the kidneys are really important in the health of the heart. And then what else are we seeing? So we have thyroid, we have kidneys, we have spleen to check. This is a really, by the way, this this iris, yes, there's cholesterol. Yes, that's intense a little bit, right? Really, really a lot of inflammation. A ton of inflammation. You can see that in the sclera. And then, you know, with cholesterol, that cholesterol, you know, it's one of those things that you will see the medical establishment, you know, cholesterol is very connected to the health of the heart. High cholesterol is one of those warning signs. The way I see it is that the cholesterol is there, and this is a fact because of the inflammation. So it's more like something you know, which came first. I would say that the inflammation is way more of a problem, and that is the reason that the body is producing excess cholesterol. And in this iris, you can really see that. You can see all this up in the top. Let me see. All up in here. See, it's like shimmery. And this person, this was a client, and she did have really high cholesterol. Really, really pretty dang strong genetics though. Really strong genetics in this eye. We have some discoloration, and I wanted to use this eye because of the fact that it's showing a pretty not unusual, not unusual. You don't see it a lot, a psora or a drug deposit or a pigmentation right in the heart area. So it's not rare, but I think it's super interesting. And I will say that you'll probably come across this once in a while. So what would that mean if you have a psora spot right in the heart area? Let me go ahead and just map this out real quick. So you have not seeing a lot in this. I mean, this is pretty dang strong. Not seeing a lot in the kidney area. All right, so what would cause a drug deposit? And so we have to look at this concept of psora, and this is it right here. This whole area, I would say, is sort of defining itself. And so we have the concept of psora. And I think that it's something that iridologists are still exploring. One thing we do, well, we know a few things. It is considered an inherited sign, but it also can be seen, they will show up if like right around, you know, the age of 7 or 8, a lot of times. And that is attributed to the very common occurrence of childhood illness around that age that is usually suppressed. They also, so, you know, they can be given any number of pharmaceuticals, you know, antibiotics, whatever, to suppress it. But really, and that may not be the drug deposit itself. It may be more that the toxin that was trying to come out through the body, through the normal, you know, processes of detoxification and healing, wasn't able to. So we have these ideas, and also they have been noted after vaccination. So that would be something to look out for also. But we have these different observations made by Jensen and by various of, you know, German iridologists, that the drug itself can appear in its crude form, and that has been shown. So if the drug was like an orangey or brown or, you know, whatever, you could see that in its crude form. And then there's another idea also, and I think that both of these can be happening, is that it's more of an enzymatic process. So it's enzymes showing up in a response to a process of the body, and those enzymes are creating this discoloration. I would consider this an inherited sign in this iris in particular. And it's interesting because you can see in this eye, it's not, you can see the different discoloration, especially coming from the stomach area and going up into the head and brain area. So to me, that would indicate some kind of enzymatic function or lack of function coming from the bowels. Or could be that, a lot of what will happen is the color will show up in the area that is the most likely to detox it out. So a lot of times, I think the most common area that you see psora spots is the liver. And in this case, it looks like, something was ingested maybe into the digestive system. Or you could also just have this case of fermentation. You could definitely have, lymphatic congestion. To me, this does not look like, obviously the whole eye does have some congestion and inflammation, but this does not actually look like, chronic lymphatic congestion. This looks like an actual substance or a toxin or something being created from an imbalance within the gut. And it looks like the digestive system has, tried to do its business and get rid of this, but that it's still remaining in the body. That would be one guess. But whatever the case, let's go back to the heart. We have this really distinct, very dark, very likely inherited psora or discoloration. We do know with the psora spots that they are on the surface of the iris fibers. A lot of times, especially if they're generationally passed, they'll have sort of burrowed down even into the fibers a little bit. You can see that at high level magnification. But there's a couple more things I want to show you in this eye. So just to finish up in this heart area, specifically, I'm also seeing, along with this discoloration, which I'm going to color back in, and then a little bit right here, and just this whole area, and even just like that whole area sort of defining itself. It's a little bit darker in there. The fibers are a little bit less tightly woven. And it's interesting, I don't know if this is just me, it could be that when you look at a really strong constitution, you don't see a lot, but I do think that I have noticed that really strong constitutions are the ones where I do see inherited heart weakness. So this is probably someone who's going to, live to be 90 or 100 and then just, pass peacefully in the night. So it's nothing like that, but because this constitution is so strong, but overall, like compared to the rest of the iris, it's definitely an area that you would be drawn to, this whole heart area. And then there is a pretty specific marking that I want to talk about, because I wouldn't consider it a defect, but that would probably be what it would be called by German iridologist Joseph Deck, and that is right in this area. I'm going to circle it because my highlighter doesn't record on the video, but so let me just show you again this very small marking right in there. And that's a pretty similar marking to what you would see if someone had an acute injury, like a broken bone. I've seen that in cases like that. And so what Joseph Deck did say in his iridology book is that when you see these small defects, they can be a sign that there has been an incident, there has been an event that has occurred in the heart and that this person has healed. Okay. And what else? Have we seen the, yeah, so let me just trace out the bowel wall real quick. It looks pretty, you know, this being the descending colon right here next to this, the whole heart area. It doesn't look like anything too crazy is going on with the bowel wall. I mean, there are some dips here and there for sure, but I'm not seeing anything. It definitely does change a little bit around the heart area. But not too much. Okay, and then I think almost last thing here, there is a lot of lymphatic congestion, a lot of cholesterol. You can see it looks like it's increasing, even possibly forming more of even like a sodium ring or a cholesterol ring all around the periphery, especially at the top of the iris. But we're also seeing a pretty significant weakness in the skin. Which is out in the very most outermost zone. And especially it is a little bit more pronounced in this heart area. Now that could just be because there's so much cholesterol at the top of the iris and at the bottom that you can't even, it's covering the weakness in the skin. So what does the health of the skin have to do with the blood and the heart? Well, the skin does reflect the health of the blood and the circulatory system itself. Also the health of the skin is connected to the thyroid. So which is connected to the metabolism and sweating. So your skin needs certain things in order to release toxins. And that is to be healthy, clean, to be exposed to air, natural fibers. Dry brushing is excellent for your skin. And so, yeah, the skin needs to be releasing toxins, or those toxins are going to be put onto the kidneys. So then we have more stress on the kidneys, and then we're going to have more stress on the heart. So it's one way that the skin affects the skin reflects the health of the blood, which is very much related to the health of the heart. So that would be another thing you would want to check, would be the skin zone. And I think that's it for this iris. I think I might leave the next eye I have for next time. I did want to ask you guys, if you're still here, if you want to submit photos, I could do another video if we can get anything interesting. So one thing I am going to be talking about in the near future at some point in one of these videos is how heartbreak, emotional, especially sudden shock and grief can appear in the iris. And that's been talked about by pretty much every iridologist that I've studied. And the way that will appear, I mean, it will probably evolve over time. I don't have any great examples of that. I did work with one person in particular. It's not a person that I would share her iris photo. So again, you know, sidetracking, when you send me photos, unless it's something where you want to have your photos, you know, shown for educational purposes, I consider iris photos very private, sacred even. So I either delete them after the reading. Usually that is what I do, unless I think someone will be wanting to do a follow-up. But if you do send photos in, don't include, and it's just for, so if you send me photos for a reading, great, I'm going to want, you know, your health info. But if you want to send in photos for this particular video that I want to do, then don't include your, you know, all your personal information. And so that would be, if anybody is still watching and they want to submit photos, if you have any interesting features, this would be related to the heart. If you have any interesting features and the photos are decent and you want me to talk about that, then I will. And we'll do that sometime in the near future. But I do have another iris I want to cover. Again, I have lots more to talk about. I think that's good for today, though. If you have any questions, again, feel free. And until next time.